Welcome back to this EMS program regarding peer support. So let's talk about what the Safer R model is, and this is really the basis of peer support. So we want to stabilize the individual or group and meet basic needs. And human basic needs is going to be that calm environment, get them water, get them food, allow their nervous system to rest and digest and really calm down from whatever the incident is. We want to acknowledge the crisis. Basically, their reality is true. And so people have different lenses, different factors that imprint them. And if they've recently had a child, some pediatric events may trigger them a little bit more, or something that reminds them of something else, maybe in their personal life where there's this emotional pull. So you want to acknowledge the crisis, their reality is true. Facilitate understanding, so we're just going to validate their feelings, understand that what they're going through really is emotional pain, and just support them as best as we can. So we want to also encourage effective coping, and so that's with rest, sleep, eating, walking or light exercise, discourage any overindulgence with substances, and then recovery. And this is basically have a sense of some normal routine, so what you would generally do to kind of stabilize on a regular basis. And if you need to take time off from work, that is perfectly okay. Be with family, community, and some people like to be at work. They feel better when they're kind of staying busy, and that's part of their normal routine, and that's also okay. And then referral. So we want to follow up with them as a peer supporter 24 to 48 hours, and we ask for their consent, or we might need to refer them out to our mental health counselor and embedded clinician. So let's go ahead and look at the proposal for this peer support program. So the 6 components is going to be, we're going to have an embedded clinician, mental health counselor. We're going to have Bravo time for staff, and that is 1 hour of uninterrupted time after end of shift, where they get to decompress and have that separation from being on the truck, being a 911 responder, to then going home and being with family. Really allow them that calm environment. This is where you don't clean the station, you don't chart, you really just get time to rest and relax and have that pause. It is also the SISM training, the initial and continuing education that we've talked about, and a dedicated peer support phone and email. And then agency promotion, really promoting within your agency that we are fit for life and then we are fit for duty. And that also comes with recognition of who your peer people are within your agency, which requires a uniform. There also needs to be a cultural change, and generally that is now to erase that stigma. It is okay to not be okay. And let's look at some of the financial impacts when it comes to having a peer support program. So partnering with the Northern Nevada Peer Support Network, which is what we've done in our region, which is a not-for-profit center focusing on stress resiliency for first responders. They have intern therapists that are working at a reduced rate, and that generally is less than $30,000 a year. And they are the embedded mental health clinician. They help with the SISM trainings. They're available for SISM work or one-on-one counseling with certain individuals that are difficult to stabilize, or let's call them persons at high risk. Peer support is a volunteer position, so trainings are free and time is not compensated. Other associated costs for the program is going to be a cell phone, a Bravo room with snacks and drinks, uniforms, health and wellness promotion within the agency, and those estimated costs can be anywhere from $10,000 down to $6,000. So the total cost to run a peer support program initially is going to be around $30,000. And let's look at the financial risk analysis and what it means to not have a peer support program. So the financial impact of not having a peer support program is going to be from absenteeism, liability, loss of employees, and sometimes even loss of life due to suicide. So let's look at some data and analysis. So one meta-analysis found that each dollar spent on wellness programs saves an average of $3.27 in healthcare costs per individual. And it also saves $2.73 in absenteeism per individual. Those are pretty staggering statistics. Lastly, according to the CDC, job-related stress is our country's leading workplace health problem, with productivity losses and absenteeism related to stress estimated at $225 billion each year. So let's go ahead and pause this one more time, and we're going to pick up and discuss some more qualitative data.